There was one thing when I was finished my series that had me absolutely forelock tugging, and it was this: the gap between what we knew. If you just took that corner of CAMH in Toronto, the gap between what we know and what we do not do is absolutely unforgivable. When I finished my series, I was so frustrated by the lack of political impetus to embrace change and to listen to key research that I had this day in mind. And here's what I believe. We have to connect the dots for the thinking public. And the thinking public should know this: Canada is one of 193 signatories to the WHO's landmark global strategy on alcohol passed in May 2010. Our country, as I said, has a very intelligent blueprint for a national alcohol strategy, one which is yet to be fully endorsed by the federal government. 2 years ago, the first priority of that strategy were low-risk drinking guidelines. They were endorsed. You have copies of them in your brochure today. No doubt a great beginning, but just a beginning. No leadership, no real leadership. We need to get those communities already aware of the damage to begin to work together. The medical community, the FASD community, the violence against women community, the road safety community, the breast cancer community. We need a robust discussion about this issue. How does alcohol play out in our communities in terms of suicides, kids being abused, violence, teens in the emergency room? Are we having an adult discussion? I don't think so. Which brings me to my final point. We need to apply what we learned on tobacco control and what we know so well about alcohol, and move quickly. We have known for some time that the most effective levers for making change are taxation and pricing, a reduction in accessibility, and control on advertising and marketing. We need a comprehensive public health response, and we need it fast. We need to close the gap between what we know and do not do. Increasingly, we're aware that the price of alcohol is one of the most effective approaches for reducing consumption and alcohol-related harm. We know that the more a person is exposed to marketing, the more likely they are to drink at an early age and have problems with drinking. I want to say, and this comes from my great long talks with David Jernigan, we have to show people what's happening, that it's not a coincidence about the placement of product. What we're seeing is new. These aren't corporate playgrounds that we live in. These are democracies. Earlier generations knew, for instance, that they had to create a monopoly in Ontario. They thought of that creation. I don't believe they thought of an LCBO that had marketing attached to it. We're seeing a situation where even the brightest girls are hoodwinked into believing that alcohol is essential and key to their happiness. Let's be clear about one thing. This is not alcoholism I'm talking about. So I'm going to ask you to suspend your disbelief for a moment and imagine that we're looking at a frog pond. We're looking at a frog pond where some people are getting very ill and growing warts, and other frogs, I probably said people, other frogs are sterile. Do we send in the fertility experts and the surgeons, or do we say maybe something's wrong with the water? I frankly believe something's wrong with the water. This isn't an addiction issue. It's about the impact of alcohol right across society. It's about a normalization of risky drinking, of periodic, episodic binge drinking that leads to acute and chronic problems in society. What's the problem here? We don't acknowledge alcohol as a drug. It's a fairy tale, and we haven't paid enough attention to it. Clearly, we need to act on all 41 recommendations outlined in the national strategy. Most importantly, we need to engage in all levels of government, federal, provincial, municipal, establish alcohol strategies in each Canadian province and territory. We need report cards at every level. We need to monitor the impact of harm to others, what I call secondhand drinking, and taking this tally is key. Alcohol use contributes causally to 7% of all cancers, 4% of coronary disease, 23% of all injuries, and 26% of neuropsychiatric conditions in North America. How many of you are aware of your own health risks? We need to embrace the new low-risk drinking guidelines. Most of all, I believe most of all, we need to take a hard look at the major gaps in the treatment system. When it comes to a fully integrated treatment network, the essential structure is missing in Canada. Seeking help, too often it's a matter of where you live or who you know. The attention paid to problematic substance use is inadequate, and the dedicated services are poorly funded and badly coordinated. The infrastructure in Ontario was built 20 years ago, and it's not sufficient to meet the challenges of today. Each system is doing their best, but there's no coordinated, integrated response to this social need, and there's no mandate for action. We need an injection of resources, and yesterday. It's a myth that alcoholics who want to change their lives can find the right kind of help. In truth, many of them fall through the cracks, and this is something that I've spoken many times to Nancy Poole about. Patrick Smith, co-chair of the National Treatment Strategy Working Group with us today, said, to get treatment, you have to demonstrate that you're the worst of the worst. It's like saying to a cancer patient, we can't treat you because your cancer isn't at stage 4. We wouldn't tolerate that in any other area of health. We need a full endorsement of the National Treatment Strategy. Let me continue. We need to see an expansion of screening and brief intervention. In the past 2 decades, studies have shown that early intervention yields extremely beneficial results. Systematic access to screening and brief motivational interviews should be extended to all emergency departments, university health clinics, public health sites, and other points of contact.